Rolling, everybody rolling? Everybody ready? Just ignore the camera, obviously. And just so we have it on the tape, we always do this. Give us your full name, spell it, so we have it spelled correctly.
It's Kenneth B. Schwartz, S-C-H-W-W-A-R-T-Z.
I'm going to start this way by asking, do you remember the first time you met Dr. Lynch?
He was up against this beast, and there wasn't, from his point of view, it seemed like there wasn't enough time in the day to keep up with the cancer beast. He had some of the intensity and the ferocity of the beast he was facing. So it didn't make me uncomfortable. It made me feel that this was a guy who took this monster seriously. After all of the high-dose chemotherapy and radiation, I still had a spread of the cancer to my spine, a so-called metastatic tumor. I looked at him and I said, "How do you do this job?" And he said, "By praying I don't have days like today." And he said, "We don't have a cure at this time for this condition that you're in," which was hard for my wife and me to hear. I said, "Are you going to fight with me to the end? Because I'm not going gently into that good night." And he said, "Absolutely."
What do you want to do with the time you have remaining, whatever it's going to be?
I do want to continue, if I've gotten a little bitty bully pulpit from this article, to try and send the message that we have to allow time to care. We can't be satisfied with mediocrity. And I think you need, administrators who make this a priority and who say clinical care doesn't mean just taking care of an illness or a body. It means taking care of a soul and a spirit. And I think that signal has to come from the top.
Ken knew about medicine, he knew about policy, and he did worry that what he found to be so important in healthcare, that connection between patients and caregivers, would be threatened by systems which looked just at efficiency or just at throughput. And he worried a lot about whether or not we could maintain, enhance, and celebrate what made medicine special. And that connection between patients and caregivers was so crucial. I had the pleasure of moderating the first Schwartz Center rounds, which were held at Mass General. I remember the energy that was in the room, and I remember how nervous people were. Could this work? And we had several rounds that were, I thought, spectacular. And then I had the pleasure of going to St. Vincent's Hospital in Worcester. Very different in culture from the MGH, a smaller hospital. When I walked in and saw Schwartz Rounds, and I saw the same energy, the same desire, and I saw how much the mission of the Schwartz Center resonated with the staff at St. Vincent's. That day, we knew that there was something special about the Schwartz Center Rounds, and we knew that the Schwartz Center Rounds would translate to hospitals throughout the United States, and now we're finding out throughout the world.
Schwartz Rounds are designed really to bring people together, anyone who touches the care of a patient or a family member in a given healthcare organization can come and participate in Schwartz Rounds. They are interdisciplinary places where we convene to talk about some of the social, emotional, psychological challenges that inevitably arise in the daily care of patients.
I believe when clinicians are feeling like they're being cared for in this community, that an institution says that it's okay for you to come and to be vulnerable and for you to unburden yourself in this space and to be able to give and offer support, that I believe that carries through to their patient population.
People discovering that they're not alone. Everybody puts on a good front. Everybody looks like they're doing okay, and nobody really talks about what's a problem. You can feel awfully alone if you know you've made a mistake or you know you've had trouble with something and nobody else is talking about it. You know, the logical conclusion is you're the only one, and that can be very isolating.
Schwartz Rounds at the very least reminds people there are people out there who get what you're going through. And so building a sense of community was one very powerful message.
I think that the rounds really provide that unique opportunity for caregivers to come together to talk not about what they did with a patient or the outcome of a test result or treatment with a patient, but really to focus on how you feel doing what you do day in and day out. And in that way, I'm not aware of any other venue or program that can bring a lot of different areas and subspecialties in healthcare together, sitting in the same room, sitting elbow to elbow, where the hierarchy of a division chief and a hospital orderly is broken down. Everybody's on the same playing field, same level, talking about the human side of what they do on a daily basis.
So Schwartz gives this great opportunity to talk about pretty much, as we say, the human side of medicine. So the things that keep you up at night, the things that you connect with your patients, the moral distress that people sometimes experience.
To be able to talk about certain aspects of caring for somebody in an open forum like that, where somebody else is willing to listen and then give you feedback about what you said, that I remember distinctly as being very, very special.
I remember the first time we contacted one of our surgery specialties and told him that we wanted to do it. He had never been to one, but he had heard about it. And his first thing was, we don't want to do anything where we have to cry. And I said, you don't have to cry. Interestingly enough, he chose a topic that had to do with patients that had to have disfiguring surgery. It ended up that one of their fellows told a story that was quite emotional. And it turned out to be a really powerful Schwartz Rounds.
It was a rounds about a very human, emotional side of a young cancer patient. She died from a complication from the treatment, not the disease. A very senior oncologist, a colleague of mine, standing in the back of the room, started to talk about the same thing had happened to him. A patient of his had passed away, and he was actually tearing up and crying. I later learned that was an experience that happened to him over 10 years ago. Yet it was still something in the moment. And it really, that rounds helped me understand that the connection between a patient and a caregiver is meaningful, and I don't think it's ever lost.
One woman told me the only time she felt safe and comfortable in the hospital was with her transporter. He would put her in this wheelchair and whisk her to wherever she had to go in the hospital, wrap her up. He would tell her stories, sing her songs, make her laugh, and she felt like they were on some little oasis that he created just for her. So I asked the department managers of these transporters if we could possibly have a rounds with his people, his team. They told these wonderful stories of the pleasure and the joy and the honor of helping people feel comfortable at the worst of possible times. When we asked, what is the most difficult part of the job that you do? They said the final transport, when you have to take somebody down to the morgue whom you've gotten to know. The entire audience rose and gave them a spontaneous standing ovation. I think it did a lot to change the culture of the organization, and that's one of the things about rounds that you just have to appreciate, that it really levels the playing ground. Everybody is a caregiver. Doesn't matter if you're in environmental services or you're the CEO, we are all caregivers and our purpose is one.
We have to realize we're all going to get sick, we're all going to need health care. People in our families are going to need it. And at that point, people are going to realize, my doctor is stressed out, my nurse is stressed out, my social worker is stressed out. We need to take care of them, we need to take care of the patients, we need to do all of that. And we're going to have to change something.
And I think Ken's vision is still true today, that if we don't prioritize or value the patient-caregiver relationship, it can still be lost.
The expectations that people have of their physicians is just really tough, especially because in a profession where you're dealing with life and death issues and so forth. You've read the statistics on physician burnout. That's terrible. They should have a place where they can just be and can just be without judgment and can be without criticism.
I mean, we're definitely filling a gap that no one's thinking about. I think people neglect the idea that caregivers have feelings too.
At the end of the day, patients care about the connection they have with their doctors, and they value that relationship. And that is very sustaining to healthcare professionals. And I think that's why I don't worry that healthcare will ever go too astray, because it's the connection with patients, and what Ken wrote about is really at the center of what makes medicine unique and special.